My name is Ammar Hallak. I'm the cardiologist here in AMMC. We're going to talk today about heart disease. Heart disease is the leading cause of death in the U.S. There are a variety of heart disease. The most common one is the coronary artery disease. Now, there are some risk factors for the coronary artery disease. Those include high blood pressure, hypertension, diabetes mellitus, high cholesterol, and also it includes like a strong family history of heart disease. Those, the coronary artery disease, usually there are symptoms for those. Usually the symptoms are chest pain, described as a pressure sensation, and usually the patient describe it as a like elephant sitting on the chest. The chest pain usually radiates to the arm and neck. Also, it has some shortness of breath, fluttering sensation sometimes, nausea, vomiting, cold sweats. So if somebody has those symptoms, it's really important to see the family doctor and the cardiologist. We'll be glad to help you diagnosing the heart disease and treat it. As you see here in the cath lab, we do cardiac catheterization, which is a test that we go from the arm or the leg with a tiny catheter and inject some contrast and find out if there's blockages in the arteries of the heart. And if there is blockages in the arteries of the heart, usually you fix it with a balloon or stent. Also here in cath lab, we do angiogram on the legs. So we do an angiogram to find out if there's blockages in the legs arteries. And if there's blockages in the legs artery, we go ahead and fix it with a balloon. And usually the symptoms for blockages in the legs are claudication. We call it claudication, which is whenever somebody has cramps in the muscle in the back of the leg. So this is a sign usually that there's blockages in the arteries of the leg, and we can fix that and make their life better. They can walk for a longer period of time. So it's really important to take care of the risk factor. So if somebody has hypertension, to take care of the blood pressure. Somebody with diabetes, it's really important to control their diabetes. Check hemoglobin A1C frequently. If they have high cholesterol, also to make sure that we have the cholesterol under control. Physical activity is really important, and try to avoid being sedentary. Walk as much as you can, control the risk factors, and if you have any sign or symptoms of heart disease, we'll be glad to treat it here and diagnose it for you. We also, here in cath lab, we do pacemakers. Some people will have a rhythm problem that the heart is too fast sometimes and too slow. And usually we fix that with a pacemaker. The pacemaker is like a small device that this big, goes under the skin. There will be like a couple of wires that goes to the heart, and usually it regulates the heartbeat, and usually the heart rate will be above 60 with the pacemaker on board. So this is another procedure that we do here in the cath lab. So if you do have any of these symptoms, talk to your family doctor. We'll be glad to see you. So you need to have a referral from your family doctor, and we'll be glad to diagnose and treat heart disease. Of course, we do have a brand new cath lab here. We have top equipment here, and we'll be glad to help you with the diagnosing and the treatment of heart disease.